Hello, my name is Damola Amatosho. I'm CEO and founder of Glue, a health and care management platform that helps you and your family stay healthy together. This is an idea that I had for some time and really took the last couple of months during the pandemic to think about how I could bring a solution to help families stay healthy to the rest of the world. That being said, meet my family. On the right is my sister, my mom to my left, and my brother and the youngest member of our family, my niece. So one of the things you'll notice is we all have the exact same smile. But one of the things that may not be so apparent is we actually also share the same pre-existing conditions. Specifically, my family is at high risk of hypertension and high blood pressure, and we're not alone. There's approximately 133 million Americans in the US with some kind of chronic condition, be it hypertension, diabetes, you name it. And what this really causes is a lot of stress and worry when family members don't know how each other are doing. For example, if you have an elderly parent who has medications that they're supposed to take, how do you know that they're taking them on time? And then also there's situations and when there's caregivers or multiple caregivers within a family that are responsible for administering care. And people oftentimes feel stressed out. They're not sure if people are doing well. And one of the things I thought about with my family is as we age and as my niece grows, how could we as a family stay healthier together? This is where the idea from Glue came from. You see, as a child growing up, we had these digital pets, Tamagotchis, Digimon, you name it. And the idea behind those where you kept them healthy by making sure they ate on time, they took their medicine, they exercised, all these things that you would do in this virtual world. I had this idea that you could combine IoT devices with AI and a fun and engaging interface to simulate what your family's health condition and wellness would look like. That's where the idea for Glue comes from. Glue is a family social health management and maintenance platform. It works by allowing you to select a character that acts as your avatar and then add coaches who will be able to keep track of and encourage you as you go about keeping your health goals. You add something like a Apple Watch, and then you're able to now see when people or family members are interacting and exercising or taking their medications on time, thus making something that's normally mundane and not so fun an engaging thing. Now, what's really interesting about Glue is that in 2020, we actually were able to try it out. We did a very small proof of concept by allowing someone to track the medications that their parent was taking. They would simply receive a text message that would allow them to say yes or no, and this feedback was then logged and shared over time. From there, we would then keep a track of this information and share it with the family members for how well they were doing that week. All in all, this was a gamified, fun way for the family members and the caretakers to stay involved and gave visibility into how the loved ones were doing, ultimately motivating them to a healthier state of being. As a matter of fact, one of the participants felt so strongly that she had this to say: "Many thanks for assisting me and my family, including the caregiver, in better care for my dad. Your startup service is a remarkable idea and will certainly help a lot of family who are caregiver to their loved ones." A little bit about our team. I'm CEO, founder, also a back-end engineer. Spent about 10 years doing enterprise application development at Intel. I've been lead engineer for many TechCrunch and TechStars companies, as well as 500 startups. My brother, who just graduated with his pharmacy degree and is also an MBA, and has spent almost 5 or 6 years at Walgreens in a pharmacy capacity, and has also recently started working with CVS. And then our chief design officer, Carcelina, has extensive experience working with patients from Kaiser Permanente, as well as creative mind that helped us come up with these characters and these ideas, and also has experience as a sales engineer and really kind of sales and marketing officer at Microsoft. The ecosystem today looks something like this. At the bottom left, you'll find these kind of medication reminder apps, kind of passive, static data. In the top left, you have some apps that aim to be kind of engaging and maybe collect a bit more information, but ultimately the care and making sure that people are staying healthy is still put on them. In the bottom right, you have companies that contract and will call and check in on your loved ones, but that doesn't have quite the same ring or feel. And that's where Glue comes in. Glue aims to be rich in analytics while also high in accountability, allowing you and your family to stay healthy in an engaging and fun manner. Not only that, but with your help and with the grant that we've won, we believe that Glue Tomorrow will be a medical journal, a calendar, reminders, and then your family's own chat Think about it as a Slack channel for your family's health. One place to go to know how everyone is doing, who's doing what, and who's taking care of when. These are a couple of screenshots from our mockups and our designs when we incorporate the ability to have the IoT blood glucose monitor into the system, as well as the smart pill boxes that are being designed currently. What's really great about our platform is we aim to be the go-to platform, meaning that whether it's a smart pill bottle, smart water bottle, you name it, we're going to aggregate that data and give it to you in a fun and refreshing way. Our revenue streams include B2C, allowing us to do a freemium model in which we give away certain features, such as maybe integration with your Apple Watch or your Fitbit, but then increasing when we add other capabilities, such as blood glucose monitors, the idea being that we could do a monthly or yearly subscription. In addition, we think this would be really attractive to insurance companies, employers, and anyone who has a large workforce that they want to keep healthy. As a matter of fact, COVID really showed us that. So assuming that we captured just 1% of the 75 million US adults with hypertension, and we can only reach half of them with these numbers, we do about 37 million annual recurring revenue. That being said, I appreciate your time. Thank you for learning a little bit more about Glue, a unique family social approach to health. We're building a beachhead with a freemium model, and we have scalable platform with great unit economics. Thank you.